what is the importance of fallopian tubes? Why fallopian tubes are very important? These are the fallopian tubes. We have two fallopian tubes beside the uterus. Actually, the fallopian tubes are very thin, where the fertilization occurs. Actually, this is very important for a female to have fertilization very properly in a very proper time. Where this happens, why these tubes are very important? These tubes are very thin, and if there is any infection, if the tubes are very sensitive, if the pelvic inflammatory disease develops, these tubes will have will get affected very easily. So the fertilization problem will occur. So, and even you don't even go for any abortion willingly. Sometimes few people will wants to go for abortion. No, you don't go for any abortion. Suppose in the if you are undergoing abortion, sometimes the infection the infection will come to tubal end. If you don't use proper antibiotics, if you don't want to tell that you have undergone abortion, maybe many unmarried people also will undergo abortion. Don't go abortion, don't go for pregnancy before marriage, because it is very dangerous, and after that you will develop the infertility problem. And suppose after marriage also, many people they want to settle in a good way, in a big way. What is big way? One baby you have, and after that 3-4 years you take gap, and if you want one more baby, if you want to have one more baby, you can undergo the procedure or fertilization later. You can utilize some of the drugs or OC pills or any other copper T, multi-load or some kind of things. Or you can use the barrier method like condoms or whatever you can use as contraception. But whenever the tubes are very thin, because the tubes are very thin, sometimes actually many people will tell no, one tube is problematic, one tube is normal. No, but usually the uterus is so small, the tubes are just beside each other. If one tube is getting affected, the other tube also gets affected. Sometimes the tubes for outside it is very normal, they look like normal, but the inside flagella and cilia will be getting affected. Sometimes the fertilization also will not affect, sometimes the ectopic pregnancy may occur because of the previous infections. Sometimes fertilization may not occur. Sometimes people they have to go for the higher procedures like IVF and ICSI if the tubes are problematic. Suppose if a bone is fractured, if the leg is fractured for a person, or a hand is fractured for a person, even though we go for POP, that is the plaster of Paris slabbing, and otherwise some normal kind of operation, that is nail fixing or plate fixing, whatever it is. Even though after the operation also there will be non-union or malunion, this kind of big structure only actually it is getting affected, and if we want to take with this hand, again we have to move front, and then we have to take this. We cannot use our hand very properly after any surgery. In the same way, this is very small microscopical structure, and the inside structures are microscopical, and very thin tube, and inside actually very small way of where the fertilization occurs. And in this kind of things, actually if there is anything, any flagella or cilia affected, or the tubal fluid is affected, then the fertilization process will be hampered. So this tube will not regain its normalcy. It is very thin part. So once it gets affected, it's gone. So if you undergo microsurgery also, many times microsurgery, after microsurgery also you will not get the pregnancy, because the inside structures will be getting affected, means the fertilization process will be hampered. So you have to go for IVF in that kind of cases. So be careful, don't go for any unwanted abortions, don't go for any, like if suppose if you any urinary tract infection, any other infection, if you get, immediately you go to doctor and you get it treated, because few persons tubes are very sensitive, they will get infection, means like it's gone. So be careful with the fallopian tubes. Take immediate treatment if they are having any problem.